Now, emergency departments and hospitals are witnessing attendance fall by as much as a third this year, but it's important that those who need emergency treatment know that hospitals are open and they are safe.
Absolutely. And joining us now to discuss is consultant in emergency medicine, Professor Stephen Cusack. Professor, so why has there been such a reduction in people presenting with emergencies?
Well, I think people are just fearful of catching COVID. That would be basically it. I came across a man the other day who had been knocked down by a car, and when somebody offered to call an ambulance, he said no, he didn't want the ambulance, he just wanted to go home.
Yeah, isn't that dangerous though? For example, people who need to be there and won't go there because of COVID-19?
Potentially, and that's something that's quite worrying. There's conditions, for example, like stroke, that have now become very important in terms of time.
Fast, that's the campaign they have.
Exactly, Daithí. Face, arm, speech.
Yeah.
So that would be really important. Chest pain would be another time-dependent one. Clearly, certain traumas also are very important in terms of time. So in some situations, minutes matter. And to be worried about whether or not you're going to catch COVID is probably a distraction.
Yeah, absolutely. I mean, the A&E departments, they're very significant, in our health system. But do you think that we're using them efficiently?
As in patients are using them efficiently, or the health service is using them efficiently? In general, I think patients know where to go. So, for example, a few years ago when we closed the South Infirmary in Cork, the emergency department there, people were up in arms and felt that the urgent care centre that we opened in Grona Broher, that people wouldn't know what to do with it. Here we are, a few years later, people know well when to go to the urgent care centre, for example, or to Swift Care, or to the walk-in centres that are available. They can work it out for
People
themselves.
don't like change.
They don't like change. No, none of us like change.
Yeah, in any aspect of life. And then when it comes to health as well, oh, hang on, but I've gone there for years, my mother and father went there for years, but not realising that maybe if you change course small, but it might be better and more efficient for you.
Exactly. I think you're exactly right there, Daithí. People don't like change, but people are learning where to go, when to go. You know about FAST. People on the street know about FAST. They've seen the ambulances go by with that on the side of them. I think we can trust people.
And what are the most common reasons for people showing up at A&E?
Oh, well, there's various. So we can divide life into two groups, really. The minor category of problems and the major category of problems. I guess in the minor categories would come slips, trips, falls to some extent. And then in the more major categories we have things like strokes, epilepsy, brain storms of various descriptions, heart attacks, asthma, etc. So, why do they come? 4% of our patients, for example, come because of a head injury. That's 4 in every 100 people because of head injury of various types. We have 2% of people coming with headaches, which is a very common problem for people coming into
But would they have gone to their own doctor first and then...
Often they have done,
but
sometimes they've had a sudden severe headache, for example, that would mandate coming along.
Here's a question for you. Okay, so if you're at home and if you have a problem, when should you bypass your doctor and go straight to A&E, or should you ever do that?
Well, we've mentioned if you think you're having a stroke, if you have a chest pain, a severe chest pain, if there's been a sudden collapse. These are situations in which you may well bypass your own GP. In other situations, GPs are invaluable and may be well able to, for example, either deal with the problem or direct you in the right direction.
Often people can complain about waiting for long periods of time in the A&E department, and they'll see people going in ahead of them. So how do you prioritise in the A&E department?
Very good question. Everybody's emergency is the biggest thing in their life on that day. So we use a system called triage, which is basically a French word meaning to sort, triage. It was originally introduced by Napoleon on the battlefield. Yeah, we encounter large numbers of patients in the public hospitals, so we are in a situation where we have to sort people in terms of their priority, and that's all done in a very structured way by our triage nurses. People sometimes sort themselves. Coming in the ambulance may well be a sorting way of doing things, although we do find sometimes people call the ambulance inappropriately. And in terms of you call us at the Mater Private Hospital, we will help you on the phone, online, to work out what the best thing is for you.
What have the biggest challenges been in the last year?
Well, COVID's been an immense challenge, so that has transfigured how we've been working in emergency departments generally. In terms of the public hospitals, it has had a big impact. I had come away from public practice in 2019, and I went back to it last year when we were facing this great unknown, and a lot of other people did as well. So I think that has been a huge challenge. And then it has affected how we do things in the hospital. So how we work in the emergency department has been deeply affected in terms of wearing PPE and so on. And how we work in terms of our hospitals going forward has been affected. For example, all of our patients that would come along as elective patients for surgery, for example, at the hospital, would be screened for COVID. You screen people coming in here for COVID, and we then would add the additional screen if they're going to be admitted to hospital. They would all have a COVID swab.
Yeah, I mean, obviously you've seen a fall in people presenting at the A&E department, but it's important for people to actually go and use that department because it's there for a reason. Absolutely,
yeah. And, you know, COVID is very new. It's going for, 14 months. We know what we know about it at the moment. It's very new. And its impact in other areas is new as well. What is it doing to our health service? What is it doing to people with cancers, for example, with chronic conditions that are needing follow-up, with our screening programs, with all of these things? This is still emerging. There are people, we have seen a fall off in things that you would wonder, how did COVID affect, for example, people coming along with acute appendicitis? And yet we have seen a change in that. Now, are people suffering through it and maybe surviving it, or are they coming in a worse condition? We're not too sure.
So it's important to go to A&E if you think you need to go.
Yes.
Definitely.
Yeah, absolutely.
Professor, thank you very much.
Thank you so much. Listen, and thank you very much indeed. Now, as always, if you have any queries, do contact a medical professional.